This is Jerry Hesch, orthopedic manual physical therapist at Hesch Institute in Aurora, Colorado. And my client John sustained a fall ice skating and developed pain in the medial aspect of his left sit bone that goes up towards the coccyx and then sometimes goes further up. And you've treated it with acupuncture and massage and chiropractic. Anything else?
Let's think. I've had trigger point and Rolfing.
Okay, alrighty. And the trigger point, was that injection or hands-on?
No, hands-on.
Yeah, alrighty. Well, I've screened your hip. Motion is fabulous. Equal movement, side to side. I've screened all your pelvic mobility. And you present with symmetry of position and symmetry of passive motion of all sacral movements and all ilia movements. You know, I did that really quick. You take up the slack and then you do a passive spring. You should feel a spring and a recoil. But when I come to the tailbone, and your medial lateral relationship is good between the sit bones, and your medial and lateral mobility of the sit bones is good. Sometimes there's what I call a lower windswept pelvis, and I have YouTube videos on that, so I won't elaborate at this point. But when we come to the tailbone, and I come on each side, you're much deeper on this left side. Okay? Mm-hmm. And you have transverse processes on that first coccygeal segment, and so it appears to me like the coccyx might be side bent to the left. Okay? When I come to the left side of the coccyx, and I'm trying to do spring mobility using a very small amount of force, less than 10 pounds, I don't get any movement. When I come to the right side, I can spring and get a little bit of give. Okay?
Okay.
And the research tells us that the coccyx does bend forward and backward and also bends left side, right side. So it is a movement that's been shown. I treat movement. The other thing we might find is that the sacrotuberous ligament on each side does have a small attachment to the coccyx. And so I'm indenting the right sacrotuberous ligament. And this is a normal give in the ligament, okay? And on this side, that ligament is distinctly tight. I'm not able to indent the left sacrotuberous ligament, okay? Mm-hmm. And then if I come to the ILA of the sacrum, which is the infralateral angle, it's a flat part on the bottom of the sacrum, okay? And then I come out laterally, this should be sacrospinous ligament, and that feels very tight. And if we compare that to this side, I can indent that ligament, okay? Mm-hmm. So very interesting. The treatment that I use is I, again, isolate the coccyx, and then I put the heel of my hand on the ligaments on the right side and I push for 5 minutes to the right. And then I come and I scoop the palm of my hand up and in on the left side directly on the coccyx, and then I push it to the right for 5 minutes. So I'm going to do that treatment, and then we'll come back and we'll film your response to that. And the body compensates if there is an asymmetry that's induced to the lower body, then somewhere in the upper body there will be a reflex compensation, and I'm curious to know where that is. And so what I'd like to do is look at your upper cervical spine. Mm-hmm. So if you would lie on your back, please. And I'm just going to capture your head but not your face.
Okay.
So I'm going to put this headpiece in, and then you can scoot over to midline. And let me check the camera angle.
So you've seen this before, I take it?
Oh yeah, oh certainly. As a matter of fact, the most common pattern that I find with a coccyx injury is a side bent pattern.
Interesting.
The beauty is it's a stable pattern. It's not enough damage to cause instability, and it's a 1 or 2 time correction.
Right.
And then the patient does extremely well.
Well, I'm going to be here 3 times, so...
We'll make sure.
Unless I don't need to.
We'll make sure.
Okay.
So I'm underneath your mastoid and I'm lifting up on the left. Okay? And now I'm lifting up on the right. Do you feel that resistance?
I do.
Yeah. So I think that's where your compensation is. I'm going to test rotation on the mastoid, which I'm really testing occipital rotation. And we have good mobility on both sides. So I'm going to suggest that the right side bending in the upper cervical is the way your body compensates for that left side bent
Makes sense.
pattern in the coccyx. Okay?
Okay.
So what I'm going to do is go ahead and treat that coccyx for 5 minutes on each side.
Great.
I will teach you, well, you'll have the video, you'll know what I did to you.
Perfect.
If you have another fall and you have another injury, then hopefully you'll know how to have someone help you with self-treatment.
Thank you. That'd be great.
Yeah. So I'll stop filming now, and then we'll film the response to treatment.